IVM.
Opening an account is such a headache, and in most cases, filling out long forms, slow responses from the bank, and the sheer amount of documents I need to put together. I am someone who likes things simplified, and that is why I am looking forward to using the Jupiter Money app. It's a digital banking app that simplifies banking. Take opening an account, for example. It's completely paperless, and in fact, your PAN card and Aadhaar card are the only things that you need. The whole process takes only 2-3 minutes, and it's super easy to understand. You can check out jupiter.money to know more, or download the Jupiter app on Android and iOS to get started.
Hello and welcome to the Habit Coach podcast. I am Ashdin Doctor, your habit coach, and today we have a guest with us that I have been dying to have on the Habit Coach podcast for over a year now, and she just seems too busy. But anyways, today we have the Dr. V with us on the Habit Coach podcast. Very, very famous. You must have heard of her. If not, today you're going to fall in love with her. Dr. V, during the COVID time, literally wrote the book on COVID. Right? There's actually a book that she wrote about COVID. And when my dad had COVID, that was the only book that he read cover to cover in one day. And it's filled with practical tips. However, today, we're not going to be talking about COVID because that is long gone. Today, we're going to be talking about something that is far more infectious than that virus. We're going to be talking about habits that lead to chronic lifestyle illnesses. So join me in welcoming Dr. Vishakha to the Habit Coach podcast. Doctor, welcome to the Habit Coach podcast.
Thank you, Ashton. Thank you. I'm almost embarrassed at that introduction.
Wasn't that a cool introduction?
Very. Thank you, even if I say so myself.
Vishakha, tell us a little bit about yourself.
I am a practicing physician in Bombay, and my area of interest is reversing chronic metabolic diseases, which are essentially lifestyle-driven, like obesity, type 2 diabetes, PCOS, fatty liver, dyslipidemia. The list is a rather long one.
But how did you focus on these as something that you wanted to specialize in and help people out? Like, was it something that you consciously made, or it just flowed into this?
So I practiced as a family physician, as I continue to do, for at least 5 or 6 years. And because, we are the diabetic capital of the world, and obesity and PCOS is so rampant here, that while prescribing medication, I realized the medication was not really treating the source of the problem. So it was more like camouflaging it and treating the symptoms. But in functional medicine, what I think I do now is we get to the root of the problem and we don't treat the symptoms. So I was very keen to see if I could go a step ahead at that point, because people kept coming back saying, one symptom is better, but now we've developed XYZ symptoms, probably also because of the drugs that I was prescribing. So, I was trying to see if there is a way, if we can wean patients off the medication and treat through lifestyle. So I did a lot of reading, a lot of learning, joined different courses, did different programs and started implementing it. And
was this completely different from what you had studied in college and school, etc., and one came to medicine?
Yes, I don't like to say that, but completely different. I think as doctors, we are not really trained to study not just nutrition, but even lifestyle aspects. None of it. We probably have a chapter or two, which, is a few hours in 5.5 years of medicine. But I also did a lot of reading because I've always been interested in health and fitness and just, so I used to do a lot of reading and then try to kind of extrapolate those habits in my patients, tell them, hey, why don't you try this? And not like on a prescription, because for me, it was still a learning at that point. But when
can you put it down as a prescription?
I do. I absolutely do. I put it as a lifestyle chain intervention and I underline it. And I say, this is what you need to do first. Sure, I prescribe medication. Even now, I'm not taking away from that at all. But the idea for these diseases is always to wean the patient off and make, in a matter of months. Sometimes it takes longer than a few months. But more often than not, these patients cease to be obese, they cease to be diabetic, they cease to be PCOS. And to them, it's such a novel concept because they look at you and they say, my diabetologist never told me, my diabetes can be reversed. Or they'll come to me, a new onset will say, oh, but my father is diabetic. Of course, it's in my genes. I'm bound to be diabetic. Nobody has explained to them the concept of epigenetics, the concept of lifestyle, So it's such a new thing. And because patients did so well that word of mouth, spreads quite
Of
fast.
course.
So we see huge success at the clinic. So I'm very happy with that. And I amalgamate both medicine and the
It's
lifestyle
that
change.
mixture that's important.
Of course it is.
Because, people come and say, Doctor, goli do. Like injection de do, sab theek ho jayega.
True.
Right? And when you give a lifestyle thing, like I know, at least in my experience, people are saying, "Arey, lifestyle now, who's going to worry about it? How will I actually make this change?" How do you break that barrier?
I think if somebody follows your lifestyle prescription, if I may say, really quick, the changes are so fast. That in itself is a motivating factor. So it's not like you need to wait 6 months to see a difference. I will tell a diabetic, type 2 diabetic, do what I'm saying for 2 weeks. You've been a diabetic for 10 years. 2 weeks is all I ask. Check your blood sugars. And they're like, yeah, okay, it's 2 weeks, not a big deal.
You make it sound that simple.
Yeah. Because it is that simple, really. If you follow XYZ protocol, it is that simple. And, I will say, okay, you do this and get back to me in 2 weeks. And they come back to me saying, but nobody told me this. How is my sugar half? Meko chakkar aa raha hai now. I'm feeling like dizzy, giddy because now the medication is too much for the patient.
Correct.
So now we have to start weaning off, halving the medication, lowering the medication. Then they are so motivated because they have seen this change so quick that then they're your patients for life.
And that's the interesting thing about it, right? Just like you said, they're patients for life. In their mind, they're on these medications for life when they're given the medication for the first time. And I think there's a big sense of power that comes when you say, I don't need this anymore, or I need to wean off this anymore. I need to take it one step lower, one step lesser, one step lesser. I think there's a big charge that comes from that.
Of course, absolutely. Yeah.
So so this is for our listeners. You might be having these diseases. You might have family that might have these diseases. And I pray that you never get them if you don't have them. But what are the list of these diseases typically that are your top 5 that you focus on in these chronic lifestyle diseases?
Which diseases? Like I said, obesity,
Okay.
type 2 diabetes, PCOS, hugely rampant, common, comes with so much stigma, sadly.
Correct.
Yeah, which should not be the case. Fatty liver and dyslipidemias. These would be my top 5 that I see. I see several more, but these would be the top 5.
Do you want to talk about each of them for just a few minutes on what they actually mean and what is happening in the body when each of these 5 happen?
So I'll go a step further and say all of these have inflammation as the common denominator, chronic inflammation.
All of them?
All of them.
Okay.
Yeah. The etiology of all is almost the same. Not completely, but in most cases. So I'm just saying this, as something that, like a take-home thing that somebody can, just armor themselves with this kind of information.
Is it just that the body represents them in different ways? That is why it's being in some it's obesity, some it's diabetes?
Yeah, so all of them are metabolically dysfunctional.
Correct.
Yeah, so when we talk about being metabolically dysfunctional, we look at 5 parameters. We look at your triglyceride, we look at obesity, we look at your waist ratio, we look at insulin resistance. Yeah, so when we're looking at these kind of things, we see insulin resistance, obesity in almost all of them. And this comes from chronic inflammation. And chronic inflammation comes from bad lifestyle. Now, when we talk lifestyle, we don't talk just food. We talk diet, it's sleep, it's gut health, it's stress, it's the supplements you take, the exercise or the lack of it. So when you look at all of this, and people who are typically don't exercise or have high stress or bad lifestyle, bad eating patterns, they develop chronic inflammation. And chronic inflammation then leads to you being metabolically dysfunctional with any of the 3 of the 5 criteria. And when that happens...
Oh, so there's a thing. Any of these 3
of the 5.
Of the 5.
And what happens is, this is what we call metabolic syndrome. And when you have metabolic syndrome, by the way, 12% of Americans are metabolically healthy. Do the math.
Wow.
12%. Yeah. So that's a huge number of people who are metabolically dysfunctional.
Correct.
Yeah. In India, we don't have the exact numbers, but it's more or less the same. Now, what that means is, in some patients, it will translate as just being overweight. In some patients, if you have the gene, of course, it will make it easier for you to get diabetes. But is that your fate? Hell not. In women, earlier, it can manifest as PCOS. So it depends on what part of your body is affected by that inflammation. You will develop different manifestations, what we call these lifestyle diseases. So in somebody, if it's a heart condition, will get dyslipidemias. So it depends on what. Somebody who's just eating bad and too much carb will go and sit in your fatty liver and cause visceral fat and fatty liver. So it manifests differently. But honestly, if all of them more or less require the same kind of lifestyle intervention.
These 5 parameters that you spoke about, right?
Yeah, but the ways to reduce these or to correct these 5 parameters, the method of doing it is almost the same. Then, of course, you have specifics. If somebody has a fatty liver, you'll give a different supplement, for it, or different medication for it. If somebody has diabetes, obviously you'll do something else. If somebody who's got PCOS with, say, who's being infertile, or, so there are medications, sometimes in my case, more often than not medication, but there's certain supplements. So those change. But I would say in 80% of the people, you just follow the certain way of lifestyle. And you will see all these medical parameters, the metabolic parameters, hugely change for the better.
That's fascinating. If you can get down to the root cause, you can pull it out from its, from the roots and hence have a healthier life. What are the elements that you focus first on? Is there like a set steps that you follow to get people to lower their inflammation, to get out of this metabolic condition? Like how should somebody start off or start thinking about this?
Yeah, absolutely. So I do a diet recall, of course, and I do an entire detailed medical history, the drugs that people are on, because very often drugs cause a lot of side effects. And patients come to me with those side effects as, oh my God, my cholesterol's elevated or my sugar is elevated now, when they're taking statins. Withdraw the statin, your sugar will come down. And I'm saying this because this happened to me last evening with a patient. But, and they were like, what? I'm going to have a heart issue. And I'm like, nothing's going to happen to you. Just take it off. Or, we've got so much muscle ache and pain or myalgias.
Correct.
So, of course, you do a detailed history and you do a family history. You do a genetic profiling. You make them do their blood work. And then you sit and tell them, these are the lifestyle changes starting from diet, right? So, if I can go into details, the first thing in the diet I would tell everyone across the board is just to stop sugar.
Love it. Okay, so first habit to talk about when it comes to nutrition, stop sugar.
Stop sugar. Stop all refined food. Anything that comes out of a tin, can, bottle, package has a long shelf life. It doesn't, it's going to reduce your life.
It's going to reduce your shelf life. Okay, so getting rid of sugars, getting rid of these processed foods.
Yes.
Now, fine. If instead of processed foods, what do I start eating? Because like you enter somebody's home, the kitchen is full of processed food. Right? You take it out and replace it with what? Like, what does your kitchen look like?
Okay. Before we get into that, I'd like to say, people tell me, they call me the anti-sugar evangelist, and apparently in all the interviews, which is fine by me.
Then you're on the right podcast. Because same.
Yeah, and I hope that everyone else listening to this also becomes an anti-sugar evangelist after listening to this. But we need to understand why sugar is bad for us. Because people say, oh, but it tastes so good. And oh, it's, barring that momentary satisfaction, that instant gratification, sugar offers you absolutely nothing else, right? So it reduces your immunity. It causes inflammation in every part of your body, head to toe. And that is something that needs to be drilled home. Just for that instant gratification, for the 2 minutes of sitting in front of Netflix and, having that cake or having the bag of chips. And, it's not just sugar. All processed food, it could be savory, converts into sugar in your body.
Correct.
So people say, oh, but I didn't have sugar. I had a bag of chips. Hello, the bag of chips is sugar in your body and it's going to convert into fatty liver.
Sugar converts into fatty liver. You have to explain this part because fat is what people think of as fat. There's no fat in sugar.
Yes. So that is such a sad misnomer. And I'm so glad you asked that. But it's not the fat that causes the buildup in the, blood vessels of the heart and causes heart attacks. It's not fat that causes fatty liver. The bad fat, sure, will cause it. But if you have good fat, it's going to protect you. It's not going to cause any of these blockages in any part of your body. But the sugar that you eat, the processed food that you eat, goes and converts. Because look, what happens when you eat sugar in your body? It has to go somewhere and do something. So either it's expended, which means you're constantly exercising, running, doing something, which none of us really do. I mean, we'd be spending 8 hours a day at the gym. Or it has to go somewhere. So where does it go? It goes and converts into fat, which sits around the viscera, which means it sits around the liver, the deeper organs. And then that gets converted into triglycerides. Triglycerides are nothing but fat globules. So when you do a cholesterol check, when you do a lipid check and you see your triglycerides are high, your doc will tell you, oh my God, your fat is high. Stop eating fat. And I have every second girl or patient who walks into my clinic saying, I'm on a low-fat diet. I'm still not dropping weight. I'm on a low-fat diet. My blood pressure is still high. Or, men in their 40s and 50s will come and say, I don't eat fat. Why do I have blockages in my heart? I'm like, quit the sugar, eat the fat, make the fat your friend, make the good fat your friend. It's that sugar that's converting into your triglyceride, and the triglyceride is going and causing the blockages in the heart. It's causing your fatty liver. It's causing you to be insulin resistant. That is the problem. So fats are vilified, and so sad that they're vilified. So eat the good fat.
So I love this sentence that says, don't blame the butter for what the bread did to you.
Oh, so well said.
Nah? Isn't
so
it so
well
brilliant?
said. Brilliant.
They're like, you told me not to have bread and butter. No, I said not to have the bread, have the butter.
Yeah.
We're going to take a quick break. See you on the other side.
Hey, it's been another great week on the IVM Podcasts Network. On Cyrus Says Cock and Bull, Cyrus, Ayushi, Nivedita and Abbas address the rumors about Putin having blood cancer and discuss how an American cat owner won rupees 95 lakhs in a settlement. Is the Taj Mahal a Hindu temple? Esteemed cultural writer Rana Safwi weighs in on this debate with Siddharth Bhatia on The Wire Talks. On Smarter with Sid, Siddharth ponders whether it is okay to take a nap during working hours. On Marathi Khidkitun, the Deshmukhs talk to Marathi actress Amruta Khanvilkar about her new film Chandramukhi. And on Ek Chuski Finance, Priyanka explains why research is a must in making financial decisions. We've got some exciting news for you. IVM Podcasts has just launched its merch, and our first line is out now. Head to the IVM Podcasts website and click on the Shop tab to check out our first collection of t-shirts. Do follow us on social media. We are IVM Podcasts on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Don't forget to rate us on any platforms you're listening on. You can also check us out on YouTube. We are also doing a small listener survey to better understand how you respond to our shows and advertising on the network. We would really appreciate if you could spare a few minutes to fill it. It helps us build better shows for you. And finally, we would like to thank our sponsors this week, SBI Life Insurance and Jupiter, a digital banking app.
Welcome back. All right, let's jump into the conversation.
So the fat, let me just put a caveat there though. The fat that you need to eat, of course, is grass-fed if you're eating meats, and it has to be organic and good quality fat, not the bad ones, which are typically the seed oils. So, sunflower, safflower, canola, rice bran, those are the worst kind of fats. Those will be a problem for you, and those can cause fatty liver.
Those also cause inflammation.
Of course, because they cause inflammation, they cause the fatty liver and the inflammation in the heart, which then, causes blockages. But not the good fats, not the avocados and nuts and seeds and olives. And
Make a list.
avocado. I'm going in, I think, in my favorite order. So avocados, nuts, seeds, olive oil, extra virgin especially.
Do not buy pomace. Pomace is used to make soaps. If you find pomace oil on your olive oil bottle, please throw it away or use it as a massage oil, but that's it.
Okay. So you can use the Evo oil and avocado oil. Ghee is great for you, as is some amount of coconut oil. Just make sure these are not refined fats, even the ghee and coconut oil. They are good quality and grass-fed.
Grass-fed coconut oil.
No, grass-fed ghee.
Okay. But why coconut oil in moderation? What is the...
So, I do find for some reason that, of course, it's a saturated fat and we don't have a problem with it. But the thing is that I do see sometimes lipoprotein small a go up with coconut oil. And I haven't, done a proper research over like a randomized control blind study in X number of patients to say that there is definitely no connect. And I'm also a very conservative doctor. And I say that if I don't know for sure,
don't want to prescribe it.
Do it in caution. I'm going to put out the caution there.
Fair. So get your sugar out. I have to tell you a funny story about the sugar.
Yeah.
So as you know, very anti-sugar. So one day I said that at home, why should we have sugar? If we don't have it, why are we giving it to our guests? So why should we poison them? So we banned sugar from our, and our house help then had one small hartal. They went on strike. They said, why are you taking away the sugar from our chai? And it was just like, all right, you couldn't get away from that one. But yeah, so, there is so much of sugar that is ingrained in our system, right?
My patients have stopped giving me sugar. They've learned the hard way. I'd get like laduri when laduri was not in India and came straight from Paris. And I would distribute it to my staff in front of everybody and their heart would break. So they have learned the hard way.
So sugar out. Then the other thing from your pantry, like you said, the seed oils out. What else?
All the refined food, everything that comes out of a tin, can, bottle, packet stuff, like I said. So it could be, the pastas, the ketchups, biscuits, all the patisserie products, those go. That doesn't mean you never have them. That doesn't mean we're not going to take all the fun away from your life if that's what you consider fun. But so it doesn't mean that you can never have them, but it depends on how much. So, to put things in perspective, your liver can assimilate about 50 grams of fructose in one go, which is your simplest form of sugar. So, all your liquid sugars, maple syrup, honey, agave, which people consider so great, fruit juices, they're the worst for you. Of course, honey has its benefits, but I can give you 10 other foods which don't have the ill effects of sugar and have the benefits of honey.
Correct.
So, if you really must have good quality Manuka honey, organic honey for XYZ that works for you, go ahead and do it. But then balance your sugar intake or your refined carb intake in the rest of the day. Why? Because your liver can't assimilate more than 50 grams of fructose a day. Then the extra sugar will go and convert into your fatty liver and deposits on all parts of your body, in your blood vessels. So one needs to keep that in mind. So it's not everything is out of reach, or you can never have a croissant, you can never have a pastry. It just means, okay, I really devour that pastry somewhere and I'm going to eat it, but I'm going to make sure I'm going to reduce my carb consumption in the rest of the day. And then I'm okay.
Then you're fine.
Then you're fine. Of course you're fine.
Doc, explain the difference between the glucose and the fructose, because everyone says fructose is good for you, not in like it's good for you, right? So how do you...
fructose is by far the worst.
Correct.
See, we need to understand that glucose, which comes in all your refined products, right? It's utilized by every single cell of the body. Fructose is metabolized only by the liver. So there is a huge difference. So like I said, the fructose that you take can be assimilated only that 50 grams at a time. After that, it cripples your immune system. So even if you are going to have more than 50 grams of fructose in one go, I tell everyone, the least you can do is not touch another carb for 6 to 8 hours.
Wow. Correct.
Because for the next 6 to 8 hours, it's crippling your specifically NK cells, which are your first line of defense cells. So, you don't want that to happen. So if you must, and you're what you call a carb fiend and take great pride in saying that, at least for the next 6 hours, do yourself a favor and don't eat anything carb driven, to drive that insulin spike and the leptin spike and all of that. So glucose, fructose, both bad for you. You need to understand that ultimately all convert and all have the same ill effects. But if you're going to have them judiciously, balance it through the day.
Correct. While you were talking, I remembered, we normally end up feeding our children all the sugar because ये लोग ले सकते हैं. मैं कैसे child है, बच्चा है, मतलब उनको कुछ नहीं होता है. And as a result, there's a huge increase in children's fatty liver disease, correct?
Absolutely. And PCOS, my God.
And PCOS.
I see kids, our parents come and typically the mother will come with the kid saying, school's over, virtual school, only a couple of hours. And very often I'm treating the mother, but my attention's on the child. And because I'm thinking this child is a sitting time bomb. She's going to have diabetes growing up. She currently has, because I can see the nape of the neck has what we call acanthosis, which is deepened, blackened pigmentation. I can see it in that child already. I can see that little pot belly. And I'm like, you're giving that child, while you're sitting in my clinic waiting for me, the child is having like liquid sugar, is having fruit juice.
Correct.
Or be quiet at the doctor's clinic and I will give you chocolate and I'll give you ice cream if you're good. I'm like, holy God, don't do that.
Bribe them with celery sticks, right?
Yeah, well, we don't have to go to extremes in life. But the thing is, why do children have that addiction for sugar? Because from the time you are small, the parent has created the habit of either creating a reward system or a punishment system with sugar. So now there is an affiliation. And everything in our life is actually affiliation. You think about it.
Correct.
You want your mother's food. You want, it's a source of comfort. But then you're teaching the child, because the child doesn't know better. You're teaching the child that if you're going to be good, sugar is a reward for me.
Correct.
If I'm going to be bad, sugar being taken away, that means sugar is a prized possession. So you need to rethink these things as a parent, because you're setting the template for the child's life.
Yeah, absolutely. And like you said, right, if you're bad, I will take away your chocolate. No chocolate for you when you come home today.
That's correct.
Right? And that reward sits in your head. And then later on, as we'll probably discuss when we talk about stress, we stress eat.
Yes.
And we only stress eat the stuff that we want that instant reward from, which are all these things that we've been teaching our children.
Yeah. And that's what sugar does, because it goes and stimulates the same dopamine receptors in the brain that cocaine does. But you don't give your child cocaine.
Unless you were in the 1800s, right? With Coca-Cola.
Well, I wasn't part of that generation, but but you don't tell your child, I'm going to give you, a drug if you're good at the doctor's clinic, but you don't think twice before saying that about sugar, which is why I say it's instant gratification, and you're just setting the template for a bad life.
I read somewhere that if sugar was invented in this day and age, the FDA wouldn't pass it as an appropriate thing for food. It was quite an interesting...
I don't think that's going to happen in our generation.
Not going to happen.
Yeah.
But actually, lots of countries have started putting the statutory warning on food that contains sugar. So at least steps are taking place. Okay, now everyone who is probably eating a chocolate bar while listening to us has now felt guilty enough. So let's move on.
Anti-sugar evangelist, everyone.
So moving from sugar. So sugar we understood. Seed oils we understood. What are the other elements that we can put into our food or take out that will give us some semblance of getting on the right track?
Sure. So let's see. We have 3 macros, right? We have carbs, proteins, fats. So we've spoken about the bad carbs.
Correct.
Does it mean all carbs are vilified, all are bad? Absolutely not. You have your good carbs, which are in terms of vegetables and small amount of fruit, the low glycemic fruit, which is good to have. Why are they good for you? Because they come with so much fiber, and you need fiber for gut health. Your gut is the basic premise of good health. Everything starts at the gut, like Hippocrates said, right? So you need to have vegetable. You need to have ample different vegetables. This is also something I hear parents say a lot, that my child eats only 2 vegetables. Then your child is only growing X number of microbiomes in the same strain. Your gut is like this Amazon forest that grows millions of different strains of bacteria. And the more color you eat, there's a reason we say eat the rainbow. The more color you eat, the more microbes you proliferate, the more different species you proliferate. So you need to make sure that you're eating different vegetables, you're having a little bit of fruit. Now, why is fruit not so bad for you? Fruit is not so bad for you because A, it comes with its fiber. So it reduces the time where the sugar is absorbed in your body is reduced, right?
Correct.
Also, again, the fiber is great. It's prebiotics for your gut. So you're feeding your gut microbiome. So now, does that mean you can begin with a platter of 4 fruits a day because Dr. V said fruit is good? Hell no. You have
What
to
is the portion size? I think that's the important one, right?
So again, like I said, 50 grams. So now go into your homework and check what fruit has how much. Okay. So typically you should have about 1 apple. Say if you're going to do,
one
fruit.
small apple, or the monster ones that we get now.
I don't do portion control even for my patients, ironically. No, I never do. And they look at me the first time. Never. I never do portion control. I just teach them to balance. Never begin your day. See, I'm giving out my secrets here. Never begin your day with the sugar, natural or unnatural. So don't begin your day with an apple or a spoon of honey. Begin with the protein. So
Correct.
You won't get that sugar flux. You won't get that insulin, surge. Then you want to have a fruit mid-morning or evening as a snack. Go ahead and have it. Nothing's going to happen to you. It's great for you.
Absolutely. Don't start. So I was in fact talking to my office the other day about this, and they were saying, why do we come to work tired? And I was like, that's because you've just had a carb-heavy breakfast. By the time you've reached office, you're already on your crash.
Absolutely correct.
Right? So you've entered office feeling now, I'm dead. And how are you going to function after that?
I'll tell you how you're going to function after that. When your sugar crashes, then you want to eat all the sugar in sight, right? Either you want the coffee, you want that caffeine surge.
Correct.
Or you want to eat every single thing that's sugar or refined. Why? Because, sugar has double whammy. Because it deranges your leptin and ghrelin. These are your 2 hunger hormones. One creates a sense of satiety. One causes a lot of, I call ghrelin the growling hormone. It causes a lot of growling in your stomach and says, I'm hungry. Growly ghrelin
makes you hungry.
I actually, the first time, because I used to get confused studying about it, and I used to think of it in my head as a cartoon character, growly ghrelin.
Ghrelin does have that, correct.
And so the fact is that the more you eat sugar, you have no sense of satiety. So you want to eat even more sugar, even more carb. So it's a double whammy. So when you're eating sugar, you're not only ruining your immunity and causing your inflammation, you're also never full.
Correct.
And you're grumpy, or what people call hangry. And I'm like, you're hangry because you're eating carbs. Don't blame it on hunger.
Absolutely. Get rid of the carbs, start focusing on the other macros, which was what we were talking about when we got derailed with carbs.
No, we're still talking carbs.
Sugar coming back.
So we're done with the carb as a macro.
Absolutely. All right, so do join us for the second episode where we're going to continue the discussion on understanding the different kinds of chronic lifestyle diseases that are there and what you can do about them from now onwards.
Now, if you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM Podcast app or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcast on Twitter and Instagram. If you want to reach out to me, I am at Ashdin Doc on Twitter and Instagram. We have a brand new habit coaching online course, quizzes, videos, and a lot more on the website awesome180.com. So check it out now.
There's a quick survey to fill out on ivmpodcast.com/survey. It lets us know a little bit more about who's listening to us. And you know what? We're going to do a few prizes. So, we'll do a random drawing of maybe 10 people and we'll send you all some swag. Remember, that's ivmpodcast.com/survey where you can fill out the survey.
Don't you think that if everyone around you is getting smart, you better be smarter? Hey there, I'm the traveling professor Siddharth Deshmukh and I'm back with season 2 of my podcast to make you smarter. Smarter with Sid. What's this season's focus about? Well, it's about 10-minute nuggets that will make you stand out at work. It's time to go from smart to smarter. Tune in every Tuesday and Thursday and become smarter with Sid.